Welcome to the Find Lecture Series. On behalf of the Perinatology Research Branch of NICHD and the National Institutes of Health, my name is Lami Yo, and I am one of the inventors of FINE. Before we begin, we encourage you to subscribe to our YouTube channel to learn more about fetal intelligent navigation echocardiography, or FINE, its features, and practical implementation in the clinical setting. More educational presentations will be forthcoming. In Part 1, we reviewed the value of color Doppler flow mapping in fetal cardiac examinations. This is now Part 2, and here we will teach the principles underlying the settings of color Doppler sonography and provide examples. This subject is important because both the quality and reproducibility of color Doppler recordings can be improved by understanding its settings and how to adjust them. For example, if the operator does not adjust setting parameters appropriately, there could be misinterpretation of blood flow information. Color Doppler flow mapping is the real-time display of two-dimensional flow patterns superimposed on cross-sectional pulse echo images of anatomical structures. Here is a four-chamber view, and normal diastolic flow through the mitral and tricuspid valves into the ventricles is shown in red color. This technology detects the frequency shifts of signals arising from blood. For example, the left B-mode image shows blood flowing through the umbilical arteries and vein. The right image is a color-coded map of such Doppler shifts superimposed onto the B-mode ultrasound image. Color Doppler tells the sonologist two things. First, whether blood flow is present or not, and second, the direction of flow. Please note that color Doppler does not quantify flow or provide Doppler waveforms for analysis. Now let's review the definitions and purpose of various color Doppler settings. We will cover the following topics: Doppler shift and the angle of insonation, display of color flow, direction and velocity, color Doppler box, focal zone location, pulse repetition frequency or PRF, or velocity scale, color gain, color wall filter, color persistence, and color balance or priority. At the end of this presentation, we will discuss power Doppler and directional power Doppler sonography also. Let's now review the first topic in color Doppler settings, Doppler shift, and the importance of the angle of insonation. In the last lecture, we introduced Christian Andreas Doppler, the famous Austrian mathematician and physicist, and his principle of the Doppler shift. This is the apparent change in the frequency of sound waves due to relative motion between the source of waves, or moving red blood cells, and the observer, or transducer. Here are three examples of how the Doppler shift works. The angle of insonation is defined as the angle between the ultrasound beam and blood flow direction. This is a very important parameter when performing color Doppler sonography. In the first example, the ultrasound beam and blood flow are perpendicular or 90 degrees to each other. Therefore, the angle of insonation is 90 degrees. In the second example, the ultrasound beam and blood flow are parallel, or 0 degrees to each other. Finally, the third example shows the angle of insonation to be 45 degrees. Now, the Doppler shift equation consists of four components. In sonography, the transducer sends out sound waves of a particular frequency, or the transmitted frequency, and listens to the echoes. The frequency is multiplied by the velocity of blood and the cosine of theta, which is the angle of insonation. The numerator is then divided by the velocity of sound in tissue. While the variables in this equation are almost constant, importantly, the angle of insonation can be influenced by the operator and therefore the Doppler shift. For example, as the angle of insonation becomes 0 degrees, the cosine of 0 equals 1. Looking at the equation, by substituting a cosine of 0 degrees with 1, this provides the maximum Doppler shift. Therefore, as shown in the diagram, when performing color Doppler sonography, it is optimal to image the fetal heart so that blood flow is going directly towards or away from the transducer. In other words, to obtain the maximum Doppler shift, the ultrasound beam and blood flow should be in parallel with an angle of insonation of 0 degrees. Here, color Doppler mapping is applied to the four-chamber view in which the angle of insonation is about 0 degrees. As a result, there is an appropriate color Doppler flow signal represented in red towards the transducer. In contrast, as the angle of insonation becomes 90 degrees, the cosine of 90 equals 0. This time, when substituting a cosine of 90 degrees with 0, this provides no Doppler shift. Therefore, as shown in the diagram, when performing color Doppler sonography, do not image the fetal heart so that the blood flow is perpendicular to the transducer with an angle of insonation of 90 degrees. No color flow will be detected or displayed by the ultrasound machine. Look at this example in which color Doppler is being applied to the vena cava. Notice that the angle of insonation is 90 degrees for the inferior vena cava, and therefore there is no color Doppler signal within this vessel. However, the superior vena cava does show color flow towards the right atrium, represented in red. This is because the angle of insonation is approximately 70 degrees. In this fetal heart, color Doppler is applied to both a three-vessel view and three vessels and trachea view. In the three-vessel view, forward flow in blue, away from the transducer, is clearly seen in the main pulmonary artery and cross-section of the ascending aorta. However, as the transducer moves cephalad to the three vessels and trachea view, notice that there is no color Doppler signal in the transverse aortic arch. This is because the angle of insonation between the ultrasound beam and blood flow direction within the structure is about 90 degrees. So in summary, to obtain a color Doppler signal, blood flow should never be perpendicular to the transducer. In such case, the angle of insonation will be 90 degrees and no color flow will be detected or displayed by the ultrasound machine. Instead, the angle of insonation should always be adjusted to an appropriate angle by optimizing the position of the transducer according to the vessel or cardiac area studied. Now let's review the display of color flow in Doppler imaging. The assignment of color to Doppler frequency shifts is based on its direction and velocity. When performing color Doppler sonography, there will be a color bar at the side of the screen. It is divided into two equal parts by a black bar, which indicates the baseline or zero flow on the Doppler spectrum. The color bar depicts the direction of blood flow relative to the transducer, as well as the velocity in centimeters per second. Therefore, the operator must always interpret the color Doppler image based on the color bar settings. Let's focus first on the direction of blood flow relative to the transducer. A common misconception is that red means artery and blue means vein. This is not correct. Conventionally, color flow displayed in red means there is flow towards the transducer, while color flow displayed in blue means there is flow away from the transducer. Please note that some ultrasound machines allow the color bar to be inverted. When inverting the color bar, this will also invert the color displayed on the sonographic image. Here is a 4-chamber view with color Doppler imaging. Notice that the color bar is located on the right side of the image. There is normal ventricular filling in red towards the transducer. During systole, there is also antegrade flow in blue away from the transducer through the left ventricular outflow tract, main pulmonary artery, and cross-section of the ascending aorta. Here is an image that nicely shows the changing direction of blood flow relative to the transducer. For this particular ultrasound machine, the color bar is located on the left side of the screen. The ascending aorta is shown in red color because the flow is traveling towards the transducer. However, as the aorta turns to become the transverse aortic arch, the color Doppler signal changes to blue because the flow is now traveling away from the transducer. In this example, color Doppler is applied to a parasagittal plane of the fetal abdomen. The umbilical vein enters the abdomen, and during its course, flow is displayed in different colors, red or blue, depending on the vein direction, as it eventually connects to the ductus venosus. The descending aorta also displays direction of flow in red color towards the transducer, and then in blue color away from the transducer. Finally, the umbilical artery is depicted in red as it exits the abdomen and enters the umbilical cord, since blood is flowing towards the transducer. Besides direction, the color bar also shows a velocity map, which assigns blood flow velocities to various color shades, such as orange-red or turquoise-blue. In this example, the velocity is 73 centimeters per second. There is a negative value when blood is moving away from the transducer, 0 when there is no calculated velocity, and a positive value when blood is moving towards the transducer. Lighter shades depict faster flow. For example, color Doppler displayed in an orange color or lighter saturation on the screen means that blood is flowing faster towards the transducer than if the display is in red color on the screen. Therefore, the brighter or lighter the color display, the higher the blood flow velocity. On the other hand, the darker the color display, the slower the velocity. Putting everything together, this is how to interpret the color bar. For this example, the black bar indicates 0 flow, while the red color indicates increasing velocity towards the transducer, and orange indicates the highest positive velocity. The blue color indicates increasing velocity away from the transducer, and turquoise blue indicates the highest negative velocity. The next subject is the color Doppler box. This box marks the area of interest within the ultrasound image where color Doppler signals are applied. Here, power Doppler of the fetal brain is being shown. The color Doppler information is superimposed over the grayscale image as thousands of color pixels. It is important to keep the color Doppler box as small as possible to include only the area of interest. This is because a small box may lead to an increased frame rate and better overall color resolution sensitivity. It allows display of flow across valves and vessels without real-time delay or image stuttering. On the other hand, a large box requires more Doppler pulses and increases processing time, thereby reducing the frame rate. This is an example of an appropriately sized color Doppler box. It contains only the four-chamber view and aorta rather than the entire fetal chest. For this fetus, because only color flow through the foraminal valley is being examined, the color box is focused on the right and left atria only. You may wonder if the color box should have been reduced in size near the left atrium. However, it was decided that because of active fetal movement, the box should be kept at the original size to ensure that both atria were included. What about these fetuses? On the left, the color box should have been reduced in size to include only the heart and cross-sectional descending aorta. Similarly, for the ductal arch in the right image, the color box size should also be slightly reduced to optimize the frame rate. Here is an example of directional power Doppler being applied to the four-chamber view. We will discuss this modality at the end of this presentation. Obviously, the Doppler box is too large, since it extends outside the fetal chest and even includes the umbilical cord at the bottom of the box. A large box requires more Doppler pulses and increases processing time, thereby reducing the frame rate. Also notice that there is no directional power Doppler information that is meaningful for this fetal heart. No clear red or blue Doppler signals are displayed. One of the reasons is that the velocity scale, or pulse repetition frequency, or PRF, is too low at 22 centimeters per second and should be increased. We will review this topic in detail shortly. The next setting to discuss when performing color Doppler sonography is location of the focal zone. Reflections arising from the focal zone create sonographic images that are more accurate than those from other depths. This also applies to color Doppler sonography. Therefore, to optimize the color flow image, the single focal zone should be placed at the level of the area of interest. For this fetus, the three-vessel view, three vessels and trachea view, and transverse aortic arch are being imaged using color Doppler velocimetry. Notice that the focal zone is placed at the level of these cardiac views. Here is a parasagittal view in which the aortic arch is being imaged. The single focal zone is appropriately placed at the level of the arch to optimize the color flow image. Notice the arterial branches arising from the aortic arch in blue color, depicting flow away from the transducer. We will now spend some time on a very important parameter in color Doppler sonography, which is pulse repetition frequency, or PRF, or velocity scale. Pulse repetition frequency, or PRF, indicates the number of ultrasound pulses generated by the transducer over a period of time, typically pulses per second, or kilohertz. In other words, as the name itself states, the PRF is how frequently the pulses are repeated. Here is a diagram that explains the PRF. The pulse of the ultrasound signal and the pause time comprise what is called the pulse repetition period. The number of these periods that are generated in a second is the pulse repetition frequency. So in this conceptual example, the PRF is 3 kilohertz. It follows then that changing the PRF will change the number of pulses transmitted from the ultrasound probe over a 1-second period. Now, as stated previously, the color bar also depicts velocity information in centimeters per second. Specifically, this velocity scale specifies the range of mean velocities that are presented in the color display. An important concept is that adjusting the PRF changes the velocity range. Both are directly proportional to each other, so the higher the PRF, the higher the scale of velocities that can be detected. As the scale increases, the maximum Doppler shift information that can be displayed without aliasing also increases. We will review aliasing shortly. It is noteworthy that when performing color Doppler sonography, the velocity scale, or PRF, must be optimized all the time to represent the real color velocity of the studied vessel. There are a couple reasons for this, which will be explained in the next few slides. The operator is able to manually adjust the range of the velocity scale on the ultrasound machine by adjusting the PRF control button. The first reason why the PRF or velocity scale must be optimized all the time for color Doppler sonography is that compared to pulse Doppler imaging, color Doppler is less able to detect slow-moving blood, such as in the fetal inferior vena cava. The left image shows the pulse Doppler waveform, while the right image shows color flow through the IVC, represented in red, towards the transducer. The second reason is that the velocity scale depends on the actual vascular structure that is being interrogated, and therefore should be set accordingly. For example, a high PRF allows only high velocities to reach the transducer before the next pulse. But if the velocity scale or PRF is set too high, low velocity signals will be missed, particularly in low flow vessels. This is because high wall filters, discussed later in this presentation, eliminates this information. In this short axis view of the great vessels, the PRF has been set appropriately for the flow velocities at 65 centimeters per second. This high PRF allows only high velocities to reach the transducer. Notice that there is a normal pattern and direction of blood flow in blue color through the main pulmonary artery, ductus arteriosus, and right pulmonary artery. On the other hand, let's look at this case. This is the 3 vessels and trachea view in which antegrade flow in blue color is visualized through the pulmonary artery and transverse aortic arch. However, notice that the vessels are not completely filled with color Doppler signals. This is because the velocity scale is set too high at 79 centimeters per second. The PRF should be decreased to less than 70 centimeters per second and the heart examined again using color Doppler. Now, what happens if the PRF is set too low? A low PRF allows signals from slow-moving targets to reach the transducer before the next pulse is emitted. But when there is high velocity blood flow and the velocity scale or PRF is set too low, high velocity signals will not be displayed accurately and a phenomenon known as aliasing occurs. This may lead to misinterpretation of the flow patterns. Here is an example of this concept. In this 4-chamber view, the goal is to image the pulmonary veins using color Doppler. Since there is low velocity flow in these veins, the PRF should be set low. However, in this fetus, the velocity scale or PRF has been set too high. Therefore, although color flow through the mitral and tricuspid valves is seen, low velocity color flow through the pulmonary veins is not captured. The solution is to decrease the PRF. In contrast, for this fetus, the PRF has been set appropriately low. As a result, notice there is color flow in the pulmonary veins, represented in red, towards the transducer as they enter the left atrium. Simultaneously, because of the low PRF, high velocity signals are not displayed accurately, and color flow through the atrioventricular valves demonstrates aliasing. So now that we know that the PRF or velocity scale should be optimized at all times when performing color Doppler sonography, what are some appropriate values when imaging the fetal heart? The answer depends on what is being studied. In general, when examining high velocity flow, such as flow through the atrioventricular valves, semilunar valves, and great vessels, increase the PRF so that the velocity scale ranges from approximately 40 to 70 centimeters per second. Otherwise, using low-range scales for these structures will result in aliasing. For this fetus, the PRF has been set appropriately at 50 centimeters per second. Color flow is shown clearly through the mitral and tricuspid valves, as well as the left ventricular outflow tract. But notice that there is no color Doppler signal in the pulmonary veins. This is because low velocities may not be identified when the PRF is high. Here, the velocity scale has been set at 55 centimeters per second. As a result, color flow in red towards the transducer is nicely shown in the ductal arch. When examining low velocity flow, such as the pulmonary veins and vena cava, a low PRF should be used. For example, around 20 centimeters per second. Of course, these are approximations. The point is that lowering the scale increases the sensitivity to low velocity blood flow. On the left, color and pulse Doppler velocimetry of the fetal pulmonary veins is performed. Notice that the PRF or velocity scale is appropriate at 22 centimeters per second. On the right is a different fetus. Similarly, because the velocity scale is 18 centimeters per second, color flow in blue away from the transducer is shown in the pulmonary vein. Here we want to depict the inferior vena cava on color Doppler. Since this has low velocity flow, a low PRF should be used. At 26 centimeters per second, the Doppler signal is nicely shown in red color towards the transducer. Incidentally, the aortic arch in blue color is also shown, and there is no aliasing despite the low PRF. Now let's review the important concept of aliasing in color Doppler sonography. Aliasing occurs when the blood flow velocity in the area of interest exceeds the limits of the velocity scale or PRF that is available. For example, if there is high velocity blood flow, but the velocity scale or PRF is set too low, aliasing will occur. What does aliasing look like? Let's assume a color Doppler scale depicting blood flow velocity ranging from red, slow velocity, to yellow, faster velocity towards the transducer, and dark blue, slow velocity, to light blue, faster velocity away from the transducer. Aliasing within a vessel will be displayed as adjacent colors from red to yellow to light blue to dark blue. Therefore, it presents as contradictory color velocity codes and ambiguous flow direction. In other words, there was a loss of velocity and directional information. It is noteworthy that power Doppler will not demonstrate aliasing, since there is no velocity or directional component with this modality. Here's an example of color Doppler aliasing. In order to image the pulmonary veins, the velocity scale was set low at 10.8 centimeters per second. However, this also led to color aliasing in the four-chamber view, since there is high velocity flow present. Now, is color Doppler aliasing normal or abnormal? The answer is both, depending upon which of the following three situations occur. First, aliasing can occur simply because the PRF is too low, and this would be considered a technical artifact. Such aliasing will disturb the proper interpretation of sonographic images. Second, aliasing can be seen normally in certain fetal structures where there is high velocity blood flow, such as in the ductus venosus. Indeed, aliasing is often a helpful visual cue in identifying this vessel. Finally, aliasing also appears in pathological conditions where there is abnormally high velocity in the fetal heart, often invisible on grayscale imaging. So in summary, for the first situation, aliasing is considered an artifact, while in the second and third situations, aliasing is a true phenomenon and is valuable in diagnosis. We will now present examples of each situation shown above. Let's first discuss color Doppler aliasing that occurs because the PRF is too low. Here is color Doppler interrogation of the aortic arch, in which there is high velocity flow present. Therefore, the PRF should be increased to depict the appropriate color signal. However, the operator set the velocity scale too low, and as a result, there is aliasing. This fetus has a right aortic arch and left ductus arteriosus in which the connection of aortic and ductal arches comprise a vascular ring that is U-shaped around the trachea. The transverse aortic arch is located to the right side of the trachea. Because the velocity range is set low at 31.3 centimeters per second, there is color Doppler aliasing in the great vessels. So when there is aliasing due to a low PRF, how should this be minimized? Increase the PRF or velocity scale to improve the range of velocities displayed by the machine. Let's take a look at an example. Color Dopplers being applied to the maternal vessels. Aliasing is present as a technical artifact only because the velocity scale has been set at 0.05. Notice the adjacent colors present, from red to yellow, to light blue to dark blue. To minimize the aliasing, increase the PRF. Look at the velocity scale. As the scale range is increased fourfold from 0.05 to 0.20, there is no longer aliasing in the color display, and flow direction is depicted appropriately. Color Doppler aliasing may also be seen normally in the fetus because of high velocity blood flow. The ductus venosus is a trumpet-shaped fetal vessel within the liver that connects the intra-abdominal portion of the umbilical vein with the most upper part of the inferior vena cava. The trumpet shape of the ductus venosus, in combination with the venous pressure gradient, increases the velocity of blood flow several-fold. As a result, the ductus venosus shows aliasing on color Doppler, allowing this vessel to be recognized. In this situation, aliasing is considered a normal phenomenon. The left image shows a sonographic axial plane of the upper abdomen, and aliasing of the ductus venosus is shown within the red circle. This is also evident in the parasagittal plane image. Once the ductus venosus is identified using color Doppler, the sample volume or gate can be placed in the correct location to provide the spectral Doppler velocimetry waveform as shown. Therefore, in this situation, color Doppler aliasing is valuable because it localizes the ductus venosus for spectral sampling. Remember that the aliasing is due to high velocity blood flow within the ductus venosus. We will now look at examples of aliasing occurring in pathological conditions due to abnormally high velocity blood flow in the fetal heart. For example, when aliasing is present in a vessel that normally does not show this, a cardiac abnormality may be present. Here is a fetus with tetralogy of Fallot and absent pulmonic valve. This is a rare cardiac defect associated with absent, dysplastic, or rudimentary pulmonic valve leaflets. Therefore, it is associated with severe pulmonary insufficiency, and this is documented well on color Doppler mapping. Despite an appropriate PRF, aliasing is present, a sign of abnormally high velocity blood flow. Here is another fetus in which the pulmonary valve is suspected to be thickened, and there may also be postvalvular dilatation of the pulmonary artery. Therefore, pulmonary stenosis is suspected. In this condition, there is an obstruction to pulmonary arterial blood flow. When mild to moderate pulmonary stenosis is present, however, prenatal sonographic findings can be subtle and easily missed. It is best to apply color Doppler to improve the accuracy and detection of this condition. Color Doppler demonstrates abnormally high velocities across the stenotic pulmonary valve, which is recognized by turbulent flow and color aliasing, despite an appropriate PRF at 52 centimeters per second. Color Doppler has thus confirmed the suspected diagnosis. As expected, pulse Doppler applied to the pulmonary valve demonstrates high flow velocities at 185 centimeters per second. The last example shows a fetus with a narrow pulmonary valve ring and dilated main pulmonary artery on grayscale imaging. The karyotype was positive for a deleted segment of chromosome 5. Color Doppler was then applied with an appropriate PRF. The left ventricular outflow tract shows normal forward flow in blue color away from the transducer. However, there was color aliasing through the pulmonary artery due to abnormally high velocity blood flow, as well as severe pulmonary insufficiency. Here, the entire video clip is played. The collective findings are consistent with absent pulmonary valve syndrome with pulmonary regurgitation. Notice that despite a high PRF or velocity scale setting of 0.86, the abnormally high velocity flow is still causing aliasing to appear. Indeed, pulse Doppler confirmed high velocity blood flow through the pulmonary artery at 2.47 meters per second. The next setting to review is gain. Color gain is the amplification of Doppler signals in a color Doppler ultrasound image. This setting controls the amplitude of the color display in color or power Doppler mode. We will show some examples of color gain along with the artifact known as blooming. What is the goal of color gain? To obtain an image with clearly visible Doppler flow in the region of interest. For example, in this 4-chamber view, clearly visible and normal diastolic flow through the mitral and tricuspid valves into the ventricles is shown in red color. The color gain is appropriate. Here's a different case in which the aortic arch is imaged using bidirectional power Doppler. Again, there is appropriate color gain since there is clearly visible Doppler flow. Now, what happens if the color gain settings are too low or too high? If the gain is too low, Doppler shifts are not displayed in vessels, especially those with slow flow. Flow may be present, but it is not visualized. On the other hand, if the color gain is set too high, color or power signals may overwrite the grayscale. Here is an example of low color gain. The PRF has been set appropriately at 65 centimeters per second to evaluate flow through the atrioventricular valves. However, due to the low gain, the Doppler shift is not fully displayed. Normally, when the color gain is high, this increases the sensitivity for color and expands the number of pixels encoded with color. But when the color gain is too high, this can lead to the image becoming affected by various artifacts, such as flow in non-vascular areas, color noise in a random pattern in the background, and blooming. Therefore, the color gain should be set to minimize these issues. Here is the 3-vessel view of a second trimester fetus with tetralogy of Fallot. There was a narrow pulmonary artery and dilated aorta in cross-section. Because the color gain has been set too high, there is a random scatter of color dots, pixels, or noise overlying the grayscale background. The entire video clip is depicted here. Notice the color noise in the background. Here is a different fetus. On the left, the aortic arch is depicted with an appropriate PRF at 65 centimeters per second, but the color gain setting is too high. Color signals are overriding the grayscale, and the colors in red and blue are not clean. In contrast, for the aortic arch in the right video, the PRF setting is identical at 65 centimeters per second, but this time the color gain is appropriate. There is no evidence of noise or blooming. A blooming artifact may also be seen when the color gain is set too high. The color spreads out from within the vessel or bleeds beyond the vessel wall into adjacent areas. This is a problem because it makes vessels appear larger than they truly are or leads to a false appearance of flow in surrounding tissues. Here is an example of blooming in the aortic arch. Notice that the color appears to bleed beyond the vessel wall into adjacent areas. Since blooming is gain dependent, to eliminate this artifact, lower the color Doppler gain. Here is a different case of blooming. Notice that the PRF is appropriate at 65 centimeters per second, but the gain is too high, leading to color blooming of the aortic arch. This makes the arch appear larger than it truly is. Can power Doppler also show a blooming artifact? Yes. In fact, blooming can be especially pronounced with power Doppler because it is more sensitive than color Doppler to detect flow. Therefore, it is important to reduce the gain. So what is the best method to optimize the color Doppler gain? First, increase the gain until there is color noise visualized overlying the grayscale background. Then, decrease the gain until the noise just disappears, but vessels are still filled with color Doppler signals. The next parameter to discuss is color wall filter. Adjusting the color wall filter can improve visualization of blood flow within the vessel by minimizing the contribution of wall movement to the Doppler signal. Other terms for color wall filter include vessel wall filter, low velocity reject, wall motion filter, or high pass filter. Why do we need to adjust the color wall filter? When a color Doppler signal is visualized, this does not always indicate blood flow, but can also be associated with movement. What kind of movement? Transducer movement can introduce unwanted motion information during color Doppler sonography. Additionally, fetal movement and even cardiac motion itself may lead to a false color signal within the image, giving an impression of blood flow that is actually an artifact. But the important concept here is that movement of vessel walls and surrounding tissue due to arterial pulsations also produce low-level frequency color Doppler shifts. So how can the ultrasound system give priority to signals caused by flowing blood rather than movement of vessel walls or movement of surrounding tissue? The answer is to apply color wall motion filter. The goal of color Doppler sonography is to distinguish moving blood from moving tissue and depict subtle flow patterns. Color wall filter is a setting on ultrasound machines that will filter out or remove low-frequency Doppler signals produced by movement of the vessel wall and other low velocities, for example, movement of soft tissue. Therefore, by adjusting the color wall filter, this can improve visualization of blood flow within the vessel by minimizing the contribution of wall movement to the Doppler signal. The result is a cleaner, high-velocity blood flow signal display. Now, what happens if the color wall filter is set too high? The wall filter should be applied with caution, especially when there is low flow. Setting the wall filter too high can accidentally filter out true low-velocity blood flow, such as in slow venous flow or flow within small vessels. Therefore, the wall filter should be set at the lowest possible frequency that effectively removes wall motion artifacts to prevent loss of true diagnostic Doppler information. So what are some recommended guidelines? In general, a low color filter should be used to evaluate the systemic and pulmonary veins, while a high color filter is used to evaluate the great vessels and flow across the atrioventricular valves. One way to remember this is that by lowering the wall filter, you are telling the ultrasound machine to listen to slower flow. One last comment about color wall filter. Please note that there is a relationship between color wall filter and PRF. Specifically, when the PRF is changed, the wall filter is calculated automatically and adjusted at the same time. For example, when a high PRF is selected, as in the case of high velocity blood flow, such as arterial, the wall filter will also increase. The high wall filter eliminates noise and motion artifacts from the moving vessel walls. Only flow inside the vessel and the correct flow direction is shown. However, with a low PRF, the wall filter does not remove noise from the moving vessel walls. The next color Doppler parameter to review is color persistence. This is characterized by the following features. It is a temporal smoothing technique to reduce color Doppler noise. Persistence combines prior frames with the most recently acquired frame. Therefore, color in the displayed image is averaged. Persistence superimposes color signals from different phases of the cardiac cycle. Taken together, persistence reduces the impression of pulsation. Here's an example demonstrating color persistence. On the left video, the uterine artery is being imaged using color Doppler, but with low persistence. Pulsation in the vessels is evident. In contrast, the right video shows a higher persistence. Notice that there is a reduced impression of pulsation. Indeed, the blood flow appears to persist and linger for a longer period of time. Now, for color Doppler imaging of the fetal heart, this feature is not optimal. In general, low color persistence settings should be selected for fetal cardiac assessment. By keeping the persistence low, this maintains the dynamic nature of blood flow. However, when imaging small vessels, such as the pulmonary vein, higher color persistence is utilized. This diminishes the dynamic nature of flow, producing a smoother image. High persistence also reduces temporal resolution. The last color Doppler setting to review is color balance or priority. As the name implies, color balance or priority controls the amount of color displayed on the image over bright gray echoes. In other words, color priority versus grayscale. The amount of color Doppler versus grayscale information on the image can be adjusted by the operator. A low priority for color implies more grayscale information and less color. But if the color priority is set too low, as shown in this 4-chamber view, flow may be missed. As the priority is increased, there is more color, but the color pixels are still interrupted by grayscale. For example, the echogenic focus in the left ventricle is visible, despite the color signal around it. When there is high priority for color, weight is given to color Doppler data rather than grayscale information. For cardiac chambers, it is often recommended to use a mid to high balance, which will enhance the ability to see details. Color balance also helps to confine color within the vessel walls, as shown in the left ventricular outflow tract. If color is seen on the vessel walls, the balance is probably set too high, as shown in the right video. This is the same fetus, but with a color signal on the walls of the left ventricular outflow tract. Within the grayscale bar, which is next to the color bar, color balance is represented by a green line. Specifically, the threshold value for grayscale priority is predefined by the ultrasound manufacturer and is shown as the green line. Usually, the value is relatively high to optimize the color display, but the user can adjust it. The green line indicates whether more or less pixels are used for the color image. Raising the threshold favors more color in the place of grayscale. Another interpretation is that when the balance value increases, the color image appears even in the part where the grade level of a two-dimensional image is high, in other words, the bright part. Here are some examples of color balance depicted by different ultrasound companies. Here are two examples of appropriate color balance. The left image shows diastolic flow through the mitral and tricuspid valves, represented in blue, away from the transducer. There is similar filling of both ventricles. The right image shows color flow through the ductal arch in blue. Here is another case in which there is appropriate color balance. There is color flow through the ductal arch, represented in red, towards the transducer. Color is confined within the arch walls. In this example of the left ventricular outflow tract, color is also nicely confined within the vessel walls. In contrast, this is an example of bidirectional power Doppler applied to the bifurcation of the pulmonary artery. The priority or balance for color is set higher than preferred, with color visualized on the vessel walls. In summary, we have reviewed the definitions and purpose of 9 different color Doppler settings. Now we will discuss power Doppler and directional power Doppler sonography. This is a fetus in which power Doppler is applied to the aortic arch. Let's examine some of the differences when compared to color Doppler sonography. First, remember that color Doppler detects the frequency shifts of signals arising from blood. In contrast, power Doppler sonography maps the amplitude, power, or intensity of Doppler signals instead of their frequency shift. There is no indication of velocity. The signal strength of power Doppler depends on the amount of blood cells present in the sample volume. In other words, power Doppler emphasizes the quantity of blood flow. Second, power Doppler only uses a single color in which higher power signals appear as lighter shades. Despite these unique characteristics, however, the same fundamental principles as those for color Doppler generally apply when imaging with power Doppler. Here is an example of the ductal arch imaged using power Doppler. Notice that there are both lighter and darker shades of the Doppler signal. Lighter shades indicate higher power signals. What are the advantages and disadvantages of power Doppler sonography? The first advantage is its higher sensitivity to detect flow compared to conventional color Doppler. Therefore, it is useful to detect very low flow rates. When imaging the fetal heart, keep in mind that power Doppler can further delineate and define smaller vascular structures and low flow velocities, such as the pulmonary and systemic veins. Here, the pulmonary veins are identified nicely, as shown by the white arrows. The second advantage of power Doppler is that it is less dependent on the angle of insonation. Indeed, it can detect flow that may be close to perpendicular to the ultrasound beam. For example, the renal arteries indicated by the white arrows are easily seen using power Doppler and are parallel to the ultrasound beam. However, even though the descending aorta, shown by the red arrow, and iliac arteries are almost perpendicular to the ultrasound beam, they are still easily visible on power Doppler imaging. Taken together, power Doppler has the ability to represent flow regardless of direction. While this is an advantage, it can also be a disadvantage. Power Doppler does not indicate flow direction or velocity in contrast to color Doppler, and therefore will not demonstrate aliasing. But even though there is no aliasing phenomenon, an inappropriately low PRF may still lead to noise and artifacts. This is evident when comparing the color and power Doppler bars. The color bar shows the direction of blood flow relative to the transducer, as well as the velocity in centimeters per second. Different color shades are shown, such as orange red or turquoise blue. However, the power Doppler bar shows only a single orange or sepia color. Notice that there is an absence of velocity values. The second disadvantage of power Doppler is that it is unable to demonstrate the presence or absence of turbulence. Finally, power Doppler is susceptible to flash artifacts because it is a very sensitive modality and can capture the motion of surrounding tissue. What are flash artifacts? Flash artifacts are a sudden burst of random color that fills the frame, obscuring the grayscale image. This artifact may be caused by object or transducer motion. Remember that any motion of a reflector relative to the transducer produces a Doppler shift. Here's an example that shows a more severe flash artifact due to fetal motion. The pericallosal artery is being imaged in this fetus using directional power Doppler. Here is the last example in which directional power Doppler has been applied to the placenta, and flash artifacts are evident. Now let's review the characteristics of directional power Doppler, which is being applied here to the fetal 3 vessels and trachea view. In general, the same fundamental principles as those for color Doppler apply. Directional power Doppler is a modern technology that utilizes both amplitude, intensity, and phase directional data to ensure vascular documentation. In other words, it combines the sensitivity of power Doppler with directional flow information. As a result, aliasing can be visualized. Compared to color Doppler imaging, directional power Doppler can show a higher resolution and sensitivity and allows detection of slower flows. This is a comparison of the power and directional power Doppler bars. Notice that the power Doppler bar shows only an orange or sepia color, which signifies the amplitude or intensity of flow instead of velocity. In contrast, both directional power Doppler bars from different ultrasound platforms show the direction of blood flow relative to the transducer with various color shades present. Notice that while one company does not depict velocity values, the other does show velocity data on the Doppler bar. Depending on the ultrasound platform, directional power Doppler technology may be known by different names. S-Flow is found on Samsung machines, while HD Flow, which stands for high definition, is primarily associated with GE Healthcare ultrasound machines. Here's an example of both the aortic and ductal arches examined using directional power Doppler or S-Flow. Remember that directional power Doppler can show a higher resolution and sensitivity compared to color Doppler. Here, the fetal circulation is nicely demonstrated using HD flow. Directional power Doppler has an improved sensitivity to low flow compared to color Doppler imaging. For example, this is the 4-chamber view. Although the PRF, or pulse repetition frequency, is high at 65 centimeters per second, the pulmonary vein is still demonstrated on HD flow. Now that we have reviewed color Doppler settings in detail, let's summarize the principles of an optimal color Doppler examination of the fetal heart. First, to obtain a color Doppler signal, blood flow should never be perpendicular to the transducer. In such case, the angle of insonation will be 90 degrees and no color flow will be detected by the ultrasound machine. Second, the color bar depicts the direction of blood flow relative to the transducer, as well as the velocity in centimeters per second. The user must always interpret the color Doppler image based on the color bar settings. Third, the color Doppler box should be kept as small as possible to include only the area of interest. A small box may lead to an increased frame rate and better overall color resolution and sensitivity. Fourth, to optimize the color flow image, set the single focal zone at the level of the area of interest. Adjust the PRF, or pulse repetition frequency, velocity scale, according to the flow conditions. In general, when examining high velocity flow, such as flow through the great vessels, increase the PRF. Otherwise, if the PRF is set too low, aliasing will occur. When examining low velocity flow, such as the pulmonary veins, a low PRF should be used. Next, set the color gain to obtain an optimal image of flow while minimizing noise, blooming, and artifacts. Next, set the color wall filter depending on the blood flow being evaluated. A low color filter should be used to evaluate the systemic and pulmonary veins, while a high filter is used to evaluate the great vessels and flow across the atrioventricular valves. The 8th principle of an optimal color Doppler exam of the fetal heart is to adjust color persistence. In general, select low persistence settings for fetal cardiac assessment to maintain the dynamic nature of blood flow. Finally, adjust the color balance or priority to control the amount of color displayed over bright gray echoes. Now let's review how to adjust color Doppler settings when imaging the fetal heart, depending on whether there is low or high color flow visualized. If there is low flow or a lack of color in the cardiac image, the following may be performed. First, increase the color gain, but without background noise. Decrease the PRF, or velocity scale. Optimize the Doppler angle of insonation. Decrease the size of the color box. Choose the wall filter with the lowest frequency acceptable to prevent loss of true diagnostic Doppler information. Use high color priority. Set the focal zone at the area of the level of interest. And increase color persistence. Now, if there is high flow or excessive color in the cardiac image, the following may be performed. Decrease the color gain. And second, increase the PRF or velocity scale. Let's take a look at some examples. This is the fetal aortic arch, but with excessive color Doppler flow. The PRF is appropriate at 52 centimeters per second. Therefore, the color flow can be improved by decreasing the gain. Here is another aortic arch with excessive color Doppler flow and a blooming artifact. Notice that the color bleeds beyond the vessel wall into adjacent areas. The velocity scale is also too low at 33 centimeters per second. Since blooming is gain dependent, to eliminate this artifact, lower the color Doppler gain. The PRF should also be increased. The last example shows an aortic arch, but with excessive bidirectional power Doppler flow and a blooming artifact. Notice that the color bleeds beyond the vessel wall into adjacent areas. Remember that blooming can be especially pronounced with power Doppler because it is more sensitive than color Doppler to detect flow. In addition, the velocity scale is too low at 31 centimeters per second. Since blooming is gain dependent, to eliminate this artifact, lower the gain. The PRF should also be increased. Before we conclude this presentation, we would like to mention some final thoughts on color Doppler settings. Color Doppler sonography requires a fundamental understanding of physics and ultrasound principles. Once this is achieved, this modality can become a valuable and integral component of fetal cardiac examination. By understanding color Doppler settings and how to adjust them, both the quality and reproducibility of color Doppler recordings is improved. Second, many color Doppler parameters can be automatically set by choosing appropriate ultrasound machine presets. However, adjustments and settings may still be necessary depending on the fetus and cardiac structures being examined. Finally, we recommend practicing the correct color Doppler settings in healthy fetuses before applying such settings to suspected cases of congenital heart disease. In conclusion, color Doppler sonography detects the frequency shifts of signals arising from blood. When performing color Doppler sonography, do not image the fetal heart so that blood flow is perpendicular to the transducer with an angle of insonation of 90 degrees. No color flow will be detected or displayed by the ultrasound machine. The assignment of color to Doppler frequency shifts is based on its direction and velocity. It is important to keep the color Doppler box as small as possible to include only the area of interest. This is because a small box may lead to an increased frame rate and better overall color resolution sensitivity. To optimize the color flow image, the single focal zone should be placed at the level of the area of interest. Adjusting the PRF, or pulse repetition frequency, changes the velocity range. Both are directly proportional to each other. When performing color Doppler sonography, the PRF should be optimized all the time to represent the real color velocity of the studied vessel. Aliasing occurs when the blood flow velocity in the area of interest exceeds the limits of the velocity scale, or PRF, that is available. There is a loss of velocity and directional information. Aliasing can be seen normally in certain fetal structures where there is high velocity blood flow, or aliasing can appear in pathological conditions. When the color gain is too high, this can lead to the image being affected by various artifacts, such as blooming. Color wall filter will remove low-frequency Doppler signals produced by movement of the vessel wall and other low velocities. Color persistence is a temporal smoothing technique to reduce color Doppler noise. It reduces the impression of pulsation. Color balance, or priority, controls the amount of color displayed on the image over bright gray echoes. In other words, color priority versus grayscale. Power Doppler maps the amplitude, power, or intensity of Doppler signals instead of their frequency shift. It has a higher sensitivity to detect flow compared to conventional color Doppler. Power Doppler does not indicate flow direction or velocity in contrast to color Doppler, and therefore will not demonstrate aliasing. Directional power Doppler is a modern technology that utilizes both amplitude, intensity, and phase directional data to ensure vascular documentation. Thank you very much for your attention.